Welcome back, everybody, for another deep dive.
Yeah.
This time we're looking into cataract surgery and lens replacement.
Okay.
And we're focusing on the dangers, the success rates, the options for people over 50, and, ultimately, if it's even worth the risk.
That's a good way to put it, It's about giving you the information you need
Yeah,
to make an informed decision if you ever have to deal with this common eye issue.
exactly. Because, let's face it,
Yeah.
eye surgery sounds kind of scary.
Uh-huh.
So what are the dangers? What could go wrong?
Well, first, it's important to understand that statistically, cataract surgery is incredibly safe.
Okay.
Millions of these procedures are performed every year with really high success rates.
Right.
But like any surgery, there are some inherent risks.
Okay, so let's break it down. What are those risks?
Some of the most common complications are infection and inflammation.
Okay.
It's your body's natural response to any surgical procedure.
Right.
And they're usually manageable with prompt care, but they're definitely things to be aware of.
Okay, so that makes sense. What about the replacement lens itself?
Yeah.
Are there risks associated with that?
Yes, there can be.
Okay.
Sometimes the lens might dislocate, meaning it moves out of its intended position,
Uh,
or the lens power might be slightly off, meaning your vision isn't as clear as it could be.
right.
These complications are rare, especially with experienced surgeons,
Yes.
but they are possibilities.
Of course. And I imagine that the anesthesia part of the surgery also comes with its own set of concerns, right?
You're absolutely right.
Hmm.
One common method for numbing the eye involves injections around the eye, either parabulbar or retrobulbar injections.
Mm-hmm.
And while generally safe, these injections do come with a small risk of complications such as bleeding hemorrhage or even in very rare cases, perforation of the eye.
Wow.
If perforation does occur, unfortunately, it can impact how quickly your vision recovers.
Okay, so those are definitely things you'd want to discuss thoroughly with your doctor.
Yeah.
Now, I've heard a lot about the use of lasers in cataract surgery. Is that considered safer or riskier? Or is it just a different approach?
That's a great question. And honestly, there's a lot of debate in the medical community about the use of lasers for this procedure.
Okay.
While proponents argue that lasers offer greater precision and potentially fewer complications, the research is still inconclusive.
Hmm.
Large studies haven't definitively shown that lasers are superior to the traditional ultrasound method for breaking up the cataract.
Okay.
Plus, laser surgery tends to be significantly more expensive.
So it's not necessarily a guaranteed upgrade then.
Right.
It seems like weighing the pros and cons with your ophthalmologist is really important.
Definitely.
But let's shift gears a bit and talk about the positive side. We've covered the risks, but what about the success rates? After all, that's what ultimately matters, right?
Absolutely. That's where things get really encouraging. The success rate of lens replacement surgery is remarkably high.
Okay.
Over 95% of patients achieve 20/40 vision or better after surgery.
Wow, that's impressive.
Yeah.
And 20/40 vision is the legal standard for driving, right?
Exactly. So for the vast majority of people, this means a dramatic improvement in their daily life, allowing them to drive, read, and enjoy activities with much greater clarity.
So the takeaway here is that while risks do exist, they are statistically quite low,
Yes.
and the potential for improved vision is very high. But I'm guessing success rates can vary depending on individual factors, right? Like
Yeah.
the overall health of the patient, the skill of the surgeon, things like that.
Absolutely. Success can be influenced by a variety of factors, including the type of IOL used, the complexity of the cataract, and of course the surgeon's expertise.
Right.
Finding a qualified and experienced surgeon is crucial, just as with any specialized medical procedure.
Makes sense. So you mentioned IOLs. For those over 50 who are considering this, what are their options?
Well, lens replacement is especially relevant for those over 50 because it often provides a solution where laser eye surgery may not be suitable.
Right. I could see how that would be a major factor. So what types of lenses are available for this age group?
Let's start with the most basic monofocal lenses. These provide clear vision at one distance, either near or far.
Yeah.
You might choose to have one eye corrected for reading and the other for distance, which is called monovision.
So it's like a built-in solution to needing reading glasses.
In a way, yes. It offers more flexibility and convenience than traditional glasses, though some people do experience a slight compromise in depth perception.
Right.
But many adapt quite well to this approach.
Then there are multifocal lenses, right?
Yeah.
Like bifocals and trifocals.
Exactly. These
Yeah.
are designed to provide clear vision at multiple distances, further reducing the need for glasses.
So similar to progressive lenses in eyeglasses.
Yes, the concept is similar, but it's important to note that multifocal lenses can sometimes cause side effects like glare or halos around lights, particularly at night.
Okay.
This is because the lens is designed to focus light from different distances simultaneously,
Uh-huh.
which can sometimes create those visual disturbances.
Got it. So it's about finding the right balance between benefit and potential side effects. Are there other options besides monofocal and multifocal lenses?
There's a newer type of lens called an EDOF lens, which stands for extended depth of focus.
Okay, break that down for us. What's the advantage of an EDOF lens?
It's sort of a compromise between monofocal and multifocal.
Okay.
It extends the range of clear vision without the distinct zones of a multifocal lens. So there are potentially fewer side effects like those halos or glare.
Okay.
However, you might still need glasses for some tasks.
Interesting. So lots of options to consider. Are there any other lens types we should be aware of?
Yes. There are also toric lenses specifically designed to correct astigmatism and aspheric lenses that can improve contrast sensitivity and reduce glare, especially in low light conditions.
Wow.
The technology has come a long way, and there's a lot to discuss with your doctor to determine the best fit for your individual needs.
Okay, so we've covered the potential dangers, the impressive success rates, and the wide array of lens options.
Yeah.
It seems like lens replacement, especially for those over 50, can be a real game changer when it comes to vision. But the big question remains, with those risks, even if they're small, is it really worth it?
That's the key question, isn't it? And the answer is, it depends.
Okay.
It's a very personal decision that should be made in consultation with a qualified eye care professional.
So not something to be taken lightly.
Absolutely not. A thorough consultation with a trusted ophthalmologist is essential.
Right.
They'll assess your individual needs, discuss your concerns, and help you weigh the potential risks and benefits to determine if lens replacement is the right path for you.
It sounds like knowledge is power in this situation.
It is.
The more informed you are, the better equipped you are to make the best choice for your eye health and well-being. So what are some key takeaways for our listeners so far?
The big one is that although there are some risks associated with cataract surgery,
Right.
the potential for improved vision and quality of life is significant. And for many, those benefits outweigh the risks.
Right. And it's important to remember that you're not alone in this. Millions of people undergo cataract surgery every year,
Yeah,
and the vast majority experience positive outcomes.
exactly. And we're just scratching the surface here. There's so much more to explore when it comes to the nuances of this procedure and the advancements in lens technology, but we'll dive into that in the next part of our deep dive.
That sounds good.
You know, one thing we haven't really touched on yet
Yeah.
is that even with all the advancements in technology and surgical techniques, there's still that human element
Right.
that's absolutely paramount. The skill and experience of the surgeon and the quality of the clinic you choose all play a significant role in the outcome of your surgery.
That's a great point. It's easy to get caught up in the technical details
Yeah.
and forget that there's a person behind the scalpel, so to speak.
Exactly. And it really emphasizes why it's so important to not be afraid to ask questions, seek second opinions, and really do your research
Yeah.
when choosing a surgeon in a clinic. This is your vision we're talking about. So you deserve to feel confident and comfortable with the people you entrust with your care.
Couldn't agree more. Okay, so if you're listening and you're part of that over 50 club
Yeah.
and you're tired of struggling with blurry vision or constantly reaching for your reading glasses,
Yeah.
this deep dive is just the beginning of your journey towards clearer vision.
Hopefully.
But before we move on, I want to circle back to something you mentioned earlier.
Okay.
Posterior capsule opacification, or PCO.
Mm-hmm.
You said it's the most common complication after cataract surgery.
Yeah.
Can you explain what that is and why it happens?
Of course. So during cataract surgery, the natural lens of your eye is removed,
Right.
but the capsule that held that lens in place is left intact.
Okay.
The IOL, the artificial lens, is then implanted inside this capsule.
Uh-huh.
Sometimes, though, those remaining lens cells can start to grow on the back of the capsule, making it cloudy.
So it's like a sort of delayed reaction that can happen even if the initial surgery goes perfectly.
That's a good way to put it. It can occur months or even years after the surgery. The good news is that it's treatable with a quick laser procedure that usually clears up the cloudiness. Think of it like this. Sometimes, even though the replacement lens is artificial, a bit like a film can develop on it over time, making it cloudy again. This is what we call PCO.
Okay, so that's reassuring to know. But is there anything that can be done to minimize the risk of PCO happening in the first place?
Absolutely. Several things can help. First and foremost, meticulous surgical technique is key. A skilled surgeon will thoroughly remove as much of the natural lens material as possible during the initial surgery,
Okay.
reducing the number of cells that could potentially cause PCO.
So it comes back to the surgeon's skill and experience.
To a large extent, yes, but the type of IOL used also plays a role.
Okay.
Lenses with a sharp square edge, for example, tend to create a better barrier against cell growth, making PCO less likely.
That's interesting. So even the design of the lens itself can impact long-term outcomes.
Precisely. And the innovations in lens technology continue to evolve, with some lenses now incorporating special materials or coatings that actively discourage cell growth.
Wow, the innovation in this field is really impressive.
It is.
It seems like there are multiple layers of defense against this PCO issue.
Yeah,
And even if it does occur, a laser procedure can usually fix it.
right.
So for our listeners, especially those who may be a bit apprehensive about potential complications, this should offer some peace of mind.
I hope so. We want to arm you with information, not scare you away. Remember, the vast majority of people who undergo lens replacement enjoy clear, long-lasting vision.
It all comes back to that initial conversation with your ophthalmologist, right? To talk through those individual concerns and get personalized recommendations.
Absolutely. Open communication and a trusting relationship with your eye care professional are essential.
Okay, so we've covered a lot of ground here. Potential dangers,
Yeah.
success rates, various lens options, and even this PCO issue.
Yeah, we have.
I'm feeling pretty well informed. How about you?
Me too. And I hope our listener is feeling empowered to ask the right questions and ultimately make the best decision for their individual needs. But before we wrap up this deep dive, I'd like to pose a thought-provoking question.
Ooh, I love these.
Yeah.
Hit us with it.
Imagine for a moment that you could choose any level of vision correction,
Okay.
completely free from the limitations of your current eyesight. What activities or experiences would you prioritize? Would you want crystal clear distance vision to fully enjoy those breathtaking mountain vistas?
Wow.
Or would you prioritize sharp near vision for diving deep into your favorite books and hobbies? Or maybe you'd aim for a perfect balance between the two.
That is a fantastic question. It really makes you stop and think about how much our vision shapes our experiences and aspirations. It's easy to take clear vision for granted until it starts to fade. I know I'd be relishing those crisp, vibrant sunsets without needing to fumble for my glasses. How about you?
Yeah.
What would you prioritize?
Well, if I'm being honest, I'd probably spend hours lost in the intricate details of